it says here that Nigerians spent over $3.6 billion annually on foreign healthcare under Buhari. Another story here that links to the health sector says doctors to begin nationwide strike on Thursday. This is really alarming. To spend that amount of money for healthcare is really is something. I mean, I really don't know the kind of English or words to put together, but let me just give you a little snippet to that. It says Nigerians spent at least $29.29 billion on foreign medical expenses during the 8 years of former President Muhammadu Buhari's administration, and the Punch reports that this translates to an annual spending of about $3.6 billion during the review period. You know, we're spending this kind of amount of money to get, healthcare across the country. And then our own healthcare system in this country is suffering. There's an impending strike that doctors want to back on, coming very soon. And of course, we can link all these things to the dissatisfaction that they see from their industry. I mean, we've heard of stories how many hospitals, public-owned hospitals, even some private-owned hospitals, do not have the equipment that they need. Look at how much we spend across board, and our healthcare system is suffering. So looking at this whole strike, nationwide strike thing, I think one industry, apart from education, that's a strike at all, that I don't like to see strike is really, this healthcare sector, because it's going to tell a whole lot on people who are sick, on people who are in the hospital that needs their attention. So I think we really need to work on this, and saying that they had to go all the way to Buhari's administration to bring out the flow of the problem, and linking it to the present administration. There's a lot of work to be done.
Let me wrap this conversation up by saying that until government officials no longer have access to get foreign medical aid outside, they are not going to fix anything in Nigeria. And it's as simple as that. If you are a government official, if your state doesn't have at least 2 standard hospitals, there's no reason for you to go abroad and say by privilege, you are a servant for a reason. So that privilege of going outside to get foreign aid must be that maybe you are in the case of those kidney transplants, whatever, where other people too can go abroad, where you have to travel to get those kind of medical attention. Maybe that, but not that randomly you just pick up your private jet or whatever and say you're going abroad and you deserve it and it's a privilege. So
that means we need someone that is going to hold the government.
Let the government hold themselves now and tell themselves that they are not going anywhere.